There's new research from the University of Minnesota about black newborn babies. So the research shows that black newborns' in-hospital death rate is cut in half when black newborns are cared for by black physicians rather than white physicians.
In August of 2020, after the death of George Floyd, during the height of the Black Lives Matter riots, we received word of a new study that purported to examine the birth records of 2 million patients in the state of Florida that determined beyond any shadow of a doubt that white doctors are so evil, white, and racist that them caring for black mothers actually led to double the infant deaths as compared to black doctors, and therefore the only solution to the evil white racism of those white doctors is for us to push DEI programs, affirmative action programs, in order to get more black doctors into the hospital. And it was reported on multiple different local news segments and national news segments like the one that I showed you in the open. And in fact, this reached the height of our country as it was cited by Ketanji Brown Jackson in a Supreme Court case because she was boosting this narrative in order to argue for affirmative action. And this is something that was allowed to be out there as truth for 4 years. In fact, 11 months ago, Roland Martin posted this short onto his YouTube channel where he interviewed somebody who is making the claims based on this paper.
And we can also talk about the benefit of why that means that we need more black people in the medical field. For instance, if we're looking at infant mortality, right? We know that 1 in every 90 black children, 1 in 90, will die before their first birthday. We bury them. But if you are a black mother, in a Florida study of 1.8 million births, if you are a black mother and you had a black daughter or doctor, your child's likelihood of dying was cut in half. That is huge in itself.
Now, it took 4 years. 4 years for somebody to try to replicate this research, only to discover that it was absolutely fraudulent. And in September and October of 2024, we saw a little bit of news articles talking about how this study was actually just wrong. They made an obvious data error in order to come to these conclusions. And the fact that we have a Supreme Court Justice, Ketanji Brown Jackson, citing this as an argument for affirmative action is ridiculous and absurd because nobody bothered to check this. And from late September, early October of 2024 up until the end of March, that's where we were at with this particular story. That's what we believe, that there was just an honest, genuine mistake made by these researchers that led us to a terrible conclusion and to a bunch of different various white doctors being accused of evil white racism that was so bad that they would kill black babies over it because they just didn't care hard enough because they're so evil white and racist. But we discovered recently from the Daily Caller that in fact, this was not a mistake at all. The researchers deliberately manipulated this data in order to tell a story because the actual data did not represent what they wanted to argue from. And that's what we're going to talk about today. But before we do, I want to thank everybody who supports this channel via actualjusticewarrior.com/join.
Give me the money. Give me the money. Okay.
Joining us now live on Skype to talk more about her research is Dr. Rachel Hardiman with the U of M School of Public Health. Dr. Hardiman, thanks so much for being with us this morning.
Thanks for having me.
Yeah, so you have for a long time researched maternal mortality and mortality of newborns. We know that black babies die at 3 times the rate of white babies, but your research gives us just a little bit of insight about why that might be.
Yeah, so, what we were really interested in studying with this particular analysis was the patient-physician relationship and if racial concordance, so having a provider, a physician that is the same racial identity as the newborn, if that mattered for health outcomes, particularly given that infant mortality is such a critical and important indicator of community health and well-being, and also that, at a very basic level, infants should not die and should have the opportunity to thrive and live healthy.
So look, we are going to get into the academic fraud specifically a little bit later on in this video, but I just want to point out that there are multiple problems with this research being fraudulent, consequences from that, and chief among them is that this incentivizes people to do affirmative action programs to overlook qualifications for race in order to bring in more black doctors into the fold, which by the way, if they're qualified, I don't give a damn about, but if they're not qualified, or if you're lowering the standards because you believe even with those lowered standards, they produce better outcomes, then that is going to lead to a lot of people being denied the ability to become doctors, while at the same time, you have less qualified candidates being funneled into these various communities, who, by the way, don't actually have a greater impact on infant mortality for black babies than any other kind of doctor. So already, we're creating problems on that particular end. But in addition to that, the faking of this research, what is the point of that other than to get those affirmative action goals through, which obviously these people were advocates rather than researchers? The point of that is to also stoke up racial tensions. Again, they dropped this study in August of 2020 when everybody was hyper concerned about evil white racism under every rock. And in that environment, in that climate, they decided to tell black people that white people would go all the way through medical school, take the 8 years of that journey that it takes, establish a residency for 3 years, finally start a practice, decide to go into a field where they're helping people give birth, bringing life into this world. But if those people were white, their racism would overwhelm all of that, and they would be killing black babies. Again, one of the worst things that you could possibly do, due to the fact that their subconscious, unconscious, and imaginary bias just overwhelm all of that. White people are so racist that even if you decide that you want to deliver people's babies, your racism ends up taking over and just running amok on the whole situation. And by the way, it turns out that the reasons for high black infant mortality are due to habits of the mother. So this also led them to not change those habits. So it made their situations worse or kept them the same, while at the same time warding them off trusting white doctors. Because again, the research shows, the studies show that white doctors are so evil, white, and racist that you have double the chance of your kid surviving if you go to a black doctor, because again, white people are so bad.
This is something that's been talked about for a while, but you looked at a lot of, almost 2 million births in the state of Florida to really find this link.
Yeah, so we leveraged some really important data across, almost 20 years to look at nearly 2 million births and to understand what was going on here. And what we saw was that when a black infant, a black newborn, had a black physician caring for them, the likelihood of infant death decreased significantly. It's
such important research, and I wonder now, what do we do with this information now? Where do we go?
Yeah, I think that's the $1 million question, right? And the thing that everyone wants to discuss. And what's important to say, first of all, is that our analysis isn't able to really get into the mechanisms behind what's happening here. But there are great researchers and folks really studying this issue. And I think what we have to understand is the impact that race and racism and racial bias play in the healthcare delivery system, and really start to unpack what that means for how care is delivered.
So they intentionally put this out in order to inflame racial tensions during the Black Lives Matter riots. And again, all of the consequences are negative for black people who don't trust doctors, even though the thing that leads the most to them having bad outcomes when they give birth is not showing up for prenatal care, or being overweight, or not consulting with their doctors enough. Now, according to this intentionally misleading paper, they said that the gap between black newborns and white newborns in terms of mortality declined by 58% if the black newborns were under the care of a black physician. A possible driver of this phenomenon, according to the paper, would be spontaneous bias by white physicians toward babies, the researchers wrote. Now, Ketanji Brown Jackson cited this study in 2023 in her dissenting opinion in the Admissions v. Harvard case, which found that universities that considered race of college applicants had violated the Equal Protection Clause of the 14th Amendment. Quote, "For high-risk black newborns, having a black physician is tantamount to a miracle drug. It more than doubles the likelihood the baby will survive," reads an amicus brief filed by the Association of the American Medical College. Quote, "Yet due to the enduring and significant underrepresentation of minorities in health professions, many minority patients will not receive care from a racially diverse team or from providers who were trained in a diverse environment. Now again, like I told you, in September of 2024, when they ended up trying to replicate this particular research, what they ended up discovering is that if you controlled for the weight of the newborn, the entire disparity evaporates. It zeroes out. It does not exist. And obviously, the weight of the newborn has a dramatic impact on survivability, so there's no reason to not control for that. But what we found out is that this was not a statistical error. This was not something that the researchers just bungled. They quite literally made a conscious decision, not a subconscious one, not spontaneous bias or whatever they're labeling to the evil white racist doctors, to omit this, to not control for this in order to tell a better story. And through a Freedom of Information Act request, we now have their communications that show they did exactly that. This is from the Daily Caller. A key data point was edited out from the body of the paper, apparently because it muddled the downstream policy implications of the study, according to documents obtained through the Freedom of Information Act by the nonprofit Do No Harm, which opposes politics in medical research and clinical practice. Now, the study actually originally asserted that white babies died less frequently with white doctors. Quote, white newborns experience 80 deaths per 100,000 births more with a black physician than a white physician, implying a 22% fatality reduction with race concordance in an unpublished draft. But the study's lead author, Brad N. Greenwood, wrote in the margin, I'd rather not focus on this. If we're telling the story from the perspective of saving black infants, this undermines the narrative. So just for a moment, marinate on that statement. Really think about it. These guys decide that they want to do research, of course, on the narrative of black infant mortality in order to demonstrate that black doctors are better for black babies. And what they ultimately end up discovering is that white doctors are better for white babies, and this cannot be eradicated by controlling for statistics because the black doctors don't do as good a job. So this guy says, listen, I don't want to focus on that. That was in the original draft of the study because it conflicts with the narrative. So their research that wanted to show that black doctors were better actually shows the exact opposite, and they decide that they're going to omit that part and then manipulate data in order to convince people that black doctors are better for black babies. Now, of course, that data point was axed, again, the 22% increase in white infant mortality with black doctors, and it was replaced with this quote, concordance appears to bring little benefit for white newborns, the paper reads. So a nearly 50% reduction in black infant mortality that completely gets wiped away when you control for the weight of the newborn, that's a big deal. That's very important. That's very crucial. But a 22% increase in survivability when a white newborn has a white doctor, that's irrelevant. Little benefit for those white babies, in this researcher's humble opinion. Greenwood, the Maximus Corporate Partner Professor of Business at George Mason University, wrote another note to his co-authors that may indicate he had a premeditated desired conclusion, a strong correlation between physician race and clinical outcomes, the Freedom of Information Act documents show. Greenwood wrote in a February of 2019 email that the correlation between variables had decreased after the coding fix, which he described as bad news. Quote, good news, I caught my obligatory coding area, updated results are attached. Bad news, results are not as strong. We lose the effect when physician fixed effect is included in newborns, Greenwood said in an email to his co-authors on February 16th of 2019. I think there's still enough to tell a story here. So right there, from my particular reading of this email, what we see is that this person, who again is working with the other co-authors on this particular paper, is unhappy that he's not getting the results that he wanted. And again, this dates back all the way to February of 2019. The study was published in August of 2020. So a full year plus later, this guy ends up publishing the results that he wants, that he expressly called good news, rather than bad news in an email back in February, because this was the goal. And wouldn't you know it, all it took to achieve those results was to get rid of variables like, the weight of the baby, because obviously that can't have any impact on survivability. That would be ridiculous and absurd if we actually included a key thing that indicates whether or not the infant will die in the hospital after birth is given. Now, again, back to the Daily Caller article. The study has been cited 507 times in scientific literature, but the study has made a big impact outside of academia too. Published in August 2020 amid the Black Lives Matter protests, the study has generated more public discussion in the lay press and on social media than 99% of scientific studies published in the last 5 years, according to the Altmetric. The study had received coverage on 340 outlets, including CNN, USA Today, and The Washington Post. Time magazine named one of the study's co-authors, University of Minnesota Center for Anti-Racism for Health Equity Director Rachel Hardman, as one of the country's 100 most influential people in 2024. Now, I find this to be hilarious because this was exposed as bad research, bad data that could easily be debunked based on basic controls that you would include in a study back in 2024, yet that woman was still named one of the 100 most influential people by Time magazine. Now, prior investigations by the Daily Caller News Foundation found that the University of Minnesota actually questioned applicants to its medical school about George Floyd, and that medical school spent $200,000 racial bias training. And of course, Hardiman did not respond to a request for comment. Now again, like I said earlier on in this video, there's a bunch of different problems with this. Obviously, you have the academic fraud, a fraud that was perpetrated on the American people during the height of the Black Lives Matter riots, when everybody, or the majority of people, were either trying to be more race conscious or trying to, not say anything out of line for fear of being punished for it. And these people took advantage of that, and they rocketed themselves to fame and possibly fortune in academia, and they were able to put in all these stupid ass anti-racism things in all these various universities. And through this hysteria, we got to such a point where a medical school was asking medical applications about their opinions on George Floyd as a mechanism to determine whether or not they would be admitted. But again, there's also the consequences of this, that these black doctors actually were not proven to be better off at all whatsoever. So if you're a black mother and you're pregnant and you don't want double your chance of your infant dying, you might be avoiding a white doctor, looking for the fewer number of black doctors in order to have a better outcome, when that's completely and totally unnecessary. And if that person is further away, if that person is more booked or whatever, you're skipping those prenatal appointments. That's where they really determine whether or not your kid is going to be born healthy, and that could lead to negative outcomes for the baby. More black baby infant mortality based on the idea that these people wanted black people to hate white people, and decided in order to achieve that, they would tell them that white people are so racist that they go all the way through medical school, decide to work in prenatal care, decide to work as doctors that deliver babies, just so that they could give less care to those black babies. Again, it's absolutely horrible. It's defamatory. It's disgusting. It's ridiculous. And these people did it for the fame, for the attention, for the public policy goals, and for the story that they wanted to tell. When we look back at 2020, the George Floyd event and the Black Lives Matter riots that followed, and the hysteria that went along with that, we need to look back on that with the disdain that it deserves. It's not a racial awakening. It is a bunch of substandard people, a bunch of unethical people that prove to us time and time again that they will lie, cheat, and steal in order to increase their own power. Hell, this shows that they're willing to sacrifice black babies, increase their deaths, increase their infant mortality in order to forward their narrative. Because make no mistake about it, when you don't tell black mothers to take their prenatal vitamins, when you don't tell them to visit the doctor, in fact, you warn them against visiting white doctors, that is the actual result of your actions. And again, we cannot fall into the trap of hating people based on the color of their skin, of hating people based on their race. That's what they want. And that message does not just go out to black people out there who they're trying to gin up all this hysteria within your community and direct it towards white people, but it also goes to white people. You cannot fall for those traps either, because they want us to fight. They want racism to go up because that is how they increase their own power. And again, they're willing to lie to you about key, crucial medical facts in order to do so, and it's absolutely disgusting. But you know what? Those are just my thoughts. I want to know what you guys think down in the comments below. If you like this video, then show by leaving a like, subscribe for more content, follow me on my social medias, support me via the support links in the description of this video. This has been me talking about researchers defaming white doctors. Till next time.